Imagine living in a world where every step becomes a challenge, where the very nerves that power your muscles and senses slowly fade. This is the reality for millions of people worldwide who live with Charcot-Marie-Tooth disease, or CMT. Today, we will unravel the mysteries behind this inherited neurological disorder and explore how it impacts the lives of those who face its daily challenges. Charcot-Marie-Tooth disease is not just one condition, but a spectrum of hereditary neuropathies. It affects both motor and sensory nerves, meaning it can weaken your muscles and disrupt your sense of touch, all at the same time. In fact, it is the most common inherited neurological disorder, affecting about 1 in 2,500 people worldwide. But what causes this condition? Core of CMT is a genetic mutation. In healthy nerves, signals travel rapidly through a protective covering called myelin. But in people with CMT, mutations in certain genes disrupt the formation of this myelin, or sometimes the axon itself, the core part of the nerve that carries signals. This disruption means the nerves can't communicate with the muscles properly. It's like a high-speed internet cable suddenly being slowed down to dial-up. For some, the signs of CMT begin early in childhood. Clumsiness, frequent tripping, or difficulty in running can be the first subtle clues. These children might struggle to keep up with their peers. Often the initial symptom is weakness in the lower legs and feet. Over time, the condition progresses, leading to more noticeable deformities like high arches, hammer toes, and what's known as a steppage gait, a distinct way of walking where the legs are lifted excessively to avoid tripping. But CMT is not just a childhood condition. It impacts people throughout their entire lives. CMT is a progressive disease. As the nerve fibers degenerate, the muscles they connect to atrophy, meaning they waste away. This leads to noticeable weakness, especially in the lower legs and feet, and later in the hands. Some people with CMT may require leg braces to help them walk or even wheelchairs in more advanced stages. However, not everyone with CMT has the same experience. There are many different subtypes of the disease. CMT1, the most common, characterized by demyelination, affecting the myelin sheath of the nerves. CMT2, affecting the axon directly, leading to axonal degeneration. CMTX, an X-linked form, primarily affecting males. CMT4, a rarer, more severe form, often leading to early onset and more pronounced symptoms. Let's take a closer look at these subtypes. The most common form, CMT1, particularly CMT1A, is caused by a duplication of the PM22 gene. This mutation affects the myelin sheath, which acts like insulation around a wire. As this insulation breaks down, the nerve signals slow down dramatically, leading to muscle weakness and wasting. In contrast, CMT2 affects the nerve axons directly. These nerves might maintain their conduction speeds, but the signals themselves weaken, causing muscle atrophy more rapidly. CMT2A, for instance, is often more severe, with children showing significant muscle weakness at an early age and sometimes becoming non-ambulatory by their 20s. CMT is primarily an inherited disease, passed down from one generation to the next. Most forms of CMT are autosomal dominant, which means a child has a 50% chance of inheriting the disorder if one parent carries the gene mutation. However, there are also autosomal recessive forms, like CMT4, where both parents must carry the gene mutation for their child to be affected. X-linked forms, like CMT1X, typically affect males more severely, as they inherit the defective gene from their mothers. As CMT progresses, the most visible symptoms are muscle weakness and atrophy. The degeneration of the most distal nerves, those farthest from the spine, means that the muscles in the feet and hands are affected first. This leads to the characteristic high arches and hammer toes in the feet and weakness in the hands, making tasks like writing or buttoning a shirt increasingly difficult. But CMT doesn't just affect movement. Many people experience sensory symptoms as well. Tingling, numbness, or even burning sensations in the extremities are common. These symptoms are a result of sensory nerves losing their function over time. This creates an eerie disconnect where the affected person may lose sensation in their feet but can still feel pain or discomfort. Diagnosing Charcot-Marie-Tooth disease often starts with a clinical examination. A neurologist will look for telltale signs such as muscle atrophy, weakness, and decreased reflexes. Nerve conduction studies (NCS) help measure how fast electrical signals move through the nerves. In CMT1, the signals are significantly slowed, while in CMT2, the amplitude of the signals is reduced. However, nerve studies alone may not provide a complete diagnosis. Genetic testing is now a key tool for identifying the exact mutation causing CMT. With over 90 known genes linked to the disease, modern genetic testing can pinpoint the exact subtype, offering valuable insights for family planning and disease management. Unfortunately, there is no cure for CMT, but management strategies can significantly improve quality of life. Physical therapy, for example, focuses on strengthening the remaining functional muscles and maintaining flexibility. Low-impact exercises like cycling, swimming, and yoga are highly recommended to keep muscles active without causing strain. Bracing is also a critical part of treatment. Ankle-foot orthoses, AFOs, help stabilize the feet and ankles, making it easier to walk. In some cases, orthopedic surgery may be necessary to correct severe foot deformities, such as high arches or hammer toes. Occupational therapy plays an equally important role, especially as the disease progresses to the hands. Simple modifications, like using specialized utensils or voice-to-text software, can help maintain independence in daily activities. Although CMT is currently incurable, there's hope on the horizon. Scientists are working tirelessly to better understand the genetic mechanisms behind the disease. Research into nerve regeneration and gene therapies may one day offer more than just symptom management. In fact, clinical trials are already underway to explore potential treatments that could halt or even reverse the progression of CMT. Charcot-Marie-Tooth disease may present challenges, but it does not define those who live with it. With advancements in therapy, assistive technologies, and medical research, there is hope that future generations may face fewer obstacles. While the road to a cure is still long, every step forward brings us closer to transforming the lives of people living with CMT. Thank you for watching. If you found this video informative and want to learn more about medical conditions, make sure to like, subscribe, and hit the notification bell. Together, let's stay curious, stay informed, and continue to support medical research. Knowledge is the first step towards progress. Let's take that step together.